there, HCG family. It's me, Miss HCG Girl, holding up a box. And you're wondering, what in the world is she doing? I have here uh, B12 that I inject myself once a week with. And this is a whole case that I bought from All Day Chemist. Me and two of my friends here locally inject ourselves with B12 once a week. And this case comes with 10 of these packs right here. And one of these bottles is what you inject yourself. And I personally do it once a week. I have known people that have done it every day because they're having severe hair loss. And anyway, this is a great deal from All Day Chemist. This whole pack right here, this package, is $4 for 8 bottles. So basically that's 8 weeks worth of B12. And I keep it in the refrigerator, and I keep it like in a closed drawer and in the box. And as you can see, the expiration date on this is January 2012. So that's pretty good. It lasts a long time, and I think I ended up with 6 of the packs in here. So 6 times 4 is $24. You know, you can't beat that for 48 weeks of B12. The other thing you're going to need to go get you is some kind of syringe. This little bottle right here is about 2 mLs to 2.5 mLs. And you're going to need some kind of injection needle, either like a mixing needle or a syringe, or that holds that amount. And this one that I have is a 3 ml. The needle, as you can tell right here, it's not a small needle, okay? So you're going to need some kind of needle like that. You're also going to need some kind of alcohol swabs, or you can get just regular alcohol and some cotton pads. I suggest you get you a couple of Band-Aids and a couple of paper towels, okay, because this can be messy. If you're squeamish or you have a fear of needles, I suggest you turn off my video now and go watch somebody else's video, okay? I don't want you to pass out or get nauseated or something like that. Anyway, so let's get started. You have to break the glass off this top of this bottle. And as you can see, by the way, they're Missouri Medical Supplies. Her name is April, and her YouTube name is HCG Looser. She sells this little plastic thing you could put on there, and it breaks the top for you pretty clean. And Mama Clock might. I don't know if she sells them or not. But I didn't even buy that. So I'm just giving you a tip here. What I do is I fold my napkin in a bunch so it's sort of thick, okay? And then I wrap it around the top of the bottle, okay? And I hold my finger really close to the neck, and I'm gonna hopefully pop it in one break. And so let's see if I can get this. Okay, and look, it cleanly broke the bottle. The bottle is broken now. And here's the little top that was on it. Okay, so we're gonna throw that away. And you can see right here, I'm gonna let you watch what I'm doing. Okay, so what I have is the needle here, the mixing needle, which I use this for mixing as well as injecting B12. And there's no injecting air or whatever. There is a big hole at the top of this bottle, if you can see this. So what I do is I stick it in there, and I slowly start drawing this up, okay? And it should come up to at least the 2 line, maybe the 2.5 line, and sometimes I have to stop and get the air out of the needle to add the rest of the B12. But this is just the way I do it, folks. You can do it the way you want to do it. I do this once a week for energy and to keep my hair from falling out. This round, I can honestly say, had no hair loss whatsoever on this round. I think it was 2 rounds ago, maybe in my second round, I had a lot of hair loss. And so that's what provoked me to do this. Okay, now you see where I am right here? I am where there's quite a bit in the needle, right? And what I'm going to do is shoot it up. There's a little bit that comes out. Don't worry about it. Till the air comes out of this. And I'll push all the red fluid to the top, if you can see this. Okay. All right. See right here? Now I have it up to the 2 line, and there is maybe a tad more in the bottle. I will try to get it out, but if I can't get it out, that's okay. Okay, that's about all we're going to get out of there. There's very little left in the bottle. So we're going to put that to the side, and as you can see, there's a lot of room at the top. So we want to get the air out of this needle. So I'm going to pull back and push most of the air till the red liquid starts coming out with a couple of drops. Now I'm going to clean the end of my needle, which I probably should have did before I started, right? But I'm going to clean it before we inject it in my body. Clean the end of the needle really good so it's ready to go. And as you can see, it is exactly to the 2 line. I don't know if you can see that on here. 2 line on the needle. Okay? And I'm going to inject my thigh. I have a lot of varicose vein, vein problems. In fact, I have an appointment with a doctor tomorrow to see if insurance is going to cover this, folks. So I put shorts on for this so that I could show you guys. And what I want you to do is clean the area on your leg with alcohol. Okay? Let me put this up. Hopefully you can see this, okay? By the way, my kids are here, and so we're going to clean this area, and I try to pick an area with not a lot of veins, and get your paper towel really close ready, because it could get blood or it could get B12 out of your body, and that's staining, folks. So we're going to inject. And I don't sometimes inject the needle all the way in. And just start pushing. Push all the B12 that you can in there. I did not push the needle all the way in, if you can see this. And then go ahead and pull it out. Now you see how the B12 is starting to shoot out of my leg? Just wipe it up with a little bit of alcohol and hold a paper towel on it. And let me see if I can get this back up and see you guys. All right. I am not a nurse. I am not a doctor. I know that there's a number of you that are nurses on here on HCG right now. A few of you are on HHCG that are nurses, and I don't know what, whatever your reason is, that's between you and your HCG. Go ahead and put the cap back on your needle so you don't stab anybody. I have a sharps container underneath my sink over there that I keep all my needles, because I inject every day on when I'm on phase 2, and I put them in there, and then I just throw them in the trash. My husband tapes it up and we throw it away. Now the bleeding seems to have stopped, so I'm going to put my little Band-Aid on there, because it has leaked out even after the fact, after I've injected. So we're going to just put us a little Band-Aid on there. And while I'm pretty much finished talking about that, I pulled up something to just share with you guys on B12. What does it do? One of the primary vitamin B12 benefits is its crucial role in energy metabolism. It is a vital component in the creation of red blood cells. It has been unofficially coined the energy vitamin. Doctors frequently administer injections of it to athletes as well as those who are not getting enough naturally. Although it won't directly cause weight loss, because B12 is known to increase your energy and metabolism, many claim that it may assist with the process. In turn, clinics for losing weight are known to frequently administer shots of it. And it said, it says, more things about it, but I just wanted to share that little tidbit about weight loss and about your metabolism, because when I'm on phase 2, I need all the energy I can get. And this last round, I probably should have injected myself more than once a week. This phase 2 was the hardest one yet that I've done. It was so hard on my body. I was so tired all of the time. It was an incredible journey. And maybe this next round, when I do another round, which won't be right now, I may end up doing more than one shot a week of B12. As you can see, I've given myself so many of them now that I don't even squirm, or, it doesn't hurt me. If you're the type of person that has trouble with shots, there is a sublingual form of B12. You can get that at Walmart. You can get it at Walgreens. It's just a little dropper full. You squirt it under your tongue. You hold it under there for a couple of minutes. There's also a tablet you can buy that you stick under your tongue, and it melts away, and it gives you B12 as well. And I hope that helps you. And I just wanted to pop on here to tell you guys how I do it, and that may help somebody else there. And like I said, I ordered this from All Day Chemist. There's probably other places you can order it from. And also, you could probably get your regular doctor to prescribe it for you since you're doing weight loss. A lot of doctors will even give you shots. Sometimes they'll even bill your insurance. So why don't you just ask? If you have a question, just ask them. They're very nice about it. I'll talk to you guys later. Peace out. Killing